Australian experts are urging caution after the US president delivered extraordinary statements about autism this morning. Donald Trump says America's Food and Drug Administration will notify doctors that using paracetamol in pregnancy can be associated with a risk of autism.
Now, it is important to know that here in Australia, our Therapeutic Goods Administration says paracetamol is considered safe for use in pregnancy and that it has no current active safety investigations between the common pain relief medicine and autism. Nicole Rogerson, who is the Chief Executive of Autism Awareness Australia, and Professor Andrew Whitehouse, who is the Deputy Director of the Kids Research Institute of Australia, join us now. Good morning to you both. Andrew, to you first of all, can I just get your reaction to these comments that have come out of the White House?
I mean, at best, this is a misreading of science. At worst, it's a complete misuse of science. Look, over the past decade, there has been studies that have looked at this link. There have been some studies that have shown a small, weak association between the use of paracetamol during pregnancy and an increased chance of autism of the offspring of that pregnancy. But there have also been studies that have shown no link, as well as some studies that have shown the reverse. That is, that there is actually a reduced chance. Importantly, what none of these studies have been able to show is that there is a causal link, that taking paracetamol during pregnancy is a cause of that offspring going on to develop autism. And that's why I say it's a misuse of science.
Nicole, to you, we should give some context around this. The Trump administration, or key people in it, had said within 5 to 6 months of taking office, they would try to solve autism and work out what was causing it. So that's perhaps why we're seeing this announcement. What does this mean, though, for parents here in Australia? Are you worried that it panics some people who might be pregnant at the moment?
Yeah, I do. I worry about the misinformation. And I think for those, I mean, we knew the Tylenol story was coming today. Some months ago, the President and RFK Jr. said they were going to solve autism in September. So we knew today was coming. But it actually, if you look at the press conference, it actually took a left turn, and it really bordered on the anti-vax message that we know people like RFK Jr. have been peddling for a couple of decades. So I worry about that misinformation coming into Australia, which is going to have both the effect on pregnant women now who have no reason to be panicked, but probably will be after listening to today's news. But then that broader autism is caused by vaccines nonsense. That really worries me.
Yeah, and we heard Donald Trump at the start of the pandemic make all sorts of comments about medicines and treatments and things like that, which were thoroughly debunked as well. Andrew, if people are watching this, they're slightly concerned, what's your advice to them this morning?
Oh, look, the medical guidance out there in the guidelines is saying that that untreated fever during pregnancy can also have significant effects on the mum and, of course, on the developing baby. So the medical guidance that is out there amongst the colleges is saying that paracetamol is safe in as the lowest possible doses for the shortest amount of time and under medical guidance. Scientifically, we can say that there is absolutely no evidence for a causal link yet between paracetamol and the offspring developing autism.
That is very clear. And before I let you go, Nicole, of course, not everyone watches the TV or listens to the radio or indeed engages with mainstream media. A lot of people go on social media and get their advice. And of course, we know that's a place where misinformation can really well and truly flourish. How worried are you about that today? Is there going to be a need for government agencies to look at this and really put as much factual information out there so that this misinformation does not gain a toehold?
Oh, 100%. And we were concerned the minute that this new administration announced Robert F. Kennedy as the health secretary. We knew that this misinformation was coming, and it will bleed into Australia. So I think it's on all of us to make sure we're putting forward credible scientific evidence. You know, the President said today he just had a feeling about these things. Well, that's not how science works.